Hello friends, I am Dr. Rohit Jain. I am MD Medicine, having experience of more than 13 years and working in North Delhi in various hospitals. Understanding hypertension. Our today's discussion will be on what high blood pressure is and how to prevent it. Generally, everyone would like to have a healthy and normal blood pressure, but what exactly does it mean? Basically, each time a heart beats, it pumps blood into the blood vessels. This creates pressure against the wall of the blood vessels. This is called as blood pressure. Normally in the healthy persons it rises and falls throughout the day, but when the blood pressure remains higher for a long period of time, this is called as high blood pressure and it can lead to serious complication. In general, persistent increase in blood pressure higher than normal is known as hypertension. High blood pressure usually develops over time. It can happen because of unhealthy lifestyle, not having enough regular exercises, obesity, smoking, high alcohol consumption and stress, etc. There are other risk factors which also increase the risk of developing hypertension, such as age. We know that as the people get older, their arteries stiffen up and narrow as excess fat builds up. And the second is the family history of high blood pressure. One or more close family members with hypertension increases person's risk of developing the condition. Excess salt intake is also known to increase the blood pressure. Not eating enough food with potassium can increase blood pressure and increase the risk of stroke and chronic kidney disease. Eating processed and fatty food increase fats throughout the body and make the heart work harder to push blood through the body, hence causing blood pressure to rise. On the other hand, lack of physical activity is also linked to obesity and further to the high blood pressure. Another one is stress. Reacting to stress in unhealthy ways or not managing stress can also increase the blood pressure. Moving on, hypertension does not have any obvious signs and symptoms, which is why it is called as a silent killer. It puts people at risk for several diseases from cardiovascular disease to kidney failure, stroke and even eye damage and blindness. Hence, early and accurate diagnosis is very important in the management of hypertension. Measuring the blood pressure is the only way to know whether the patient is having high blood pressure or not. Generally, when the symptoms do occur, they include morning headaches or tiredness, vision loss, buzzing in the ears, fatigue, nausea, vomiting. If person is experiencing some of these symptoms, then one should get their blood pressure checked daily or alternatively. Fortunately, high blood pressure can be easily diagnosed. It is said that your blood pressure is one of the easiest and simplest diagnostic tools which can tell one so much about their current and possible future health. It is usually measured with an instrument called as sphygmomanometer. A blood pressure is recorded in two numbers, systolic and diastolic. Now let's try to understand what do these numbers actually mean. A healthy or normal blood pressure should be lower than 120 by 80 mm Hg, or it can also be read as 120 over 80 mm Hg. Here the upper number indicates systolic blood pressure, which means the pressure in the blood vessels when the heart contracts, whereas the lower number indicates diastolic blood pressure, means the pressure in the blood vessels when the heart rests between the beats. If blood pressure level is more than 140 by 90 mm Hg, then the person is known as hypertensive. If person is having high BP, then he or she is at risk of developing a serious heart condition. The risk can be prevented by some steps such as healthy lifestyles, regular exercise, healthy diet, quitting of smoking and reduce alcohol intake, regular blood pressure monitoring, stress management and adherence to medicines. If blood pressure is successfully controlled with such lifestyle measurements, then it might avoid, reduce or delay the need for medication. So let's look at these strategies one by one. Regular exercise or physical activity. Exercise can be a drug-free approach to lower the blood pressure. Regular physical activity makes person's heart stronger. If one has a strong and healthy heart, it can pump more blood with less effort. So if heart has to work less to pump, the force on the blood vessels is less and it will lead to lower blood pressure. In other case, as we all are aware that age and weight are the two major risk factors for the high BP. So if blood pressure is of desirable level is 120 by 80 mm Hg, then exercise can help to prevent it from rising as you age. Regular exercise can also help you maintain a healthy weight, which in my opinion is an important way to control blood pressure. One should aim for at least 30 minutes of regular aerobic exercise for most days of the week. High blood pressure can be reduced by doing regular structured exercise such as brisk walking, jogging or swimming, etc. Now second is the healthy diet. Diet also plays an important role in controlling the blood pressure. A diet with a high intake of vegetable, fruits or whole grains is recommended for hypertensive patients. For lowering blood pressure or preventing hypertension through dietary intervention, one can adopt a dietary pattern such as a DASH diet or a Mediterranean diet, eating less saturated fat and total fat, getting plenty of potassium, and limiting the amount of sodium in the diet and limiting alcohol consumption. DASH stands for Dietary Approach to Stop Hypertension. Eating a DASH diet that is rich in whole grains, fruits, vegetables and low fat dairy products and skims on saturated fats and cholesterol can reduce one blood pressure by up to 11 millimeter Hg if the patient is having high blood pressure. Reduce sodium in your diet. Even a small reduction in sodium in the diet can improve the healthy heart and reduce blood pressure by about 5 to 6 millimeter Hg if you have high blood pressure. Read food labels. If possible, we should choose low sodium alternative of food and beverages which we normally buy. Eat fewer processed foods. Only a small amount of sodium occurs naturally in the foods. Most of the sodium is added during processing. So, eating natural products and avoiding processed food can decrease the sodium intake in the diet. Don't add salt. Just 1 level of teaspoon of salt has 2.3 gram of sodium. So, avoid adding sodium to your diet. Use herbs or spices to add flavor to your food. And the next step for decreasing hypertension is quitting of smoking and limiting the amount of alcohol that you drink. Stopping of smoking makes your blood pressure return to normal. Quitting smoking can effectively reduce your risk of heart disease and improve your overall health. Drinking more than the moderate amount of alcohol can actually raise the blood pressure by several points. It can also reduce the effectiveness of blood pressure medications. Hence, limited alcohol consumption is much needed in hypertensive patients. Regular blood pressure monitoring. Some of the hypertensive patients check their blood pressure by visiting doctors, but this is not always possible for patients to visit doctors and check up their blood pressure, and most often I advise patients for self-monitoring of their BP goals. Self-monitoring helps persons to measure blood pressure at different times throughout the day and over a long period of time. It also assists doctors to get a more complete picture of person's blood pressure readings at different times of his day, thus further helping him in better prediction of cardiovascular morbidity and mortality rather than a single routine blood pressure monitoring that occurs during a clinical visit. So, it is important to have a self-monitoring of blood pressure at home. Next is stress management. By learning how to relax and manage stress, it can help in overall emotional and physical health and lower the blood pressure. Stress management techniques include exercising, listening to music, focusing on something calm or peaceful, or yoga and meditation. Next is adherence to medicines. A medicine to lower blood pressure may be recommended by a doctor if your blood pressure is greater than 140 by 90 millimeter of mercury. Adherence to medicine is very important as it is control your blood pressure regularly. At last, I would like to suggest that there is nothing more precious than a fit and healthy life. Adapting healthy lifestyle can help us to enjoy long and healthy life. High blood pressure can be prevented as well as controlled in many ways. Keeping blood pressure in the normal range is very important in preventing cardiovascular complication. It is very much possible to maintain normal blood pressure levels with regular monitoring and preventive care. Thank you.